In January of 2015, my daughter, 15 years old at the time, underwent hip surgery. The doctors assured us that this was going to be routine, not to worry, it's an outpatient surgery, and thankfully they were right. She's fine and fully recovered, but to this day, I can't tell you how much the procedure cost, if she received average, above average, or the best possible care, or if she could have recovered more quickly if she had used other providers. In other words, I spend more time researching my next pair of running shoes on Zappos than I did for her surgery. Even though I work in this industry, I took these things for granted. So, how did I get here? In December of 1999, I started my career in corporate America with the Procter & Gamble Company, working on bath tissue. If you're not familiar with this category, you should probably check it out. Working on Charmin excited me for two reasons. First, because as a U.S. Marine, whenever I went to the field, I always had a roll of Charmin in my rucksack. Why? Because when you only get 2 minutes a day to yourself, you want it to be the best possible experience. Second, I thought, if you can figure out how to sell something that people literally flush down the toilet, you can probably sell anything. P&G is a great company, great brands, great ethos, but as a blue chip, they're somewhat risk averse. So in August of 2011, when the executive recruiter called with an opportunity at a high-growth Medicaid managed care organization, it interested me, even though I had no idea what Medicaid was, how it differed from Medicare, the difference between an MCO and an MSO, an HMO versus a PPO. I also learned that this company had never had a chief marketing officer before. The job description was amorphous at best, and this piqued my interest. So I started to investigate the category, and I learned a couple of really interesting things. First, healthcare is really big and growing really fast. In 1965, healthcare was only 5% of GDP. In other words, if the national economy were the alphabet, healthcare would have been the big A and the little b. By 2020, healthcare is expected to be 20% of GDP. That's like being A, B, C, D, and F, the entire grading system, which, not coincidentally, is important because most state governments have two big expenditures, education and healthcare. I also learned that America is not super healthy. Despite, over the last 50 years, nearly eradicating the #1 health issue in the country, tobacco and smoking, we're less healthy than we've ever been before. It doesn't take a medical expert to tell us that our sedentary lifestyle and lack of proper nutrition is leading to obesity, heart disease, and diabetes at rates we've never seen. In fact, this is the first generation where my children have a lower life expectancy than my parents. When I heard that, I started thinking, should I care about this category? Should I join this company? But before I answer that question, I'm going to ask you something. What's the most important thing in your life? This is the part where the audience participates, so yeah? Family, health, right. Health and family, those are actually the two most important things in your life, your health and the health of your family. So what's the brand that you depend on to help you navigate this complicated system? Yeah, even though you're participating, I'm not hearing anything because it doesn't exist. So when I figured out that the category is really big, that we're not healthy, that there's no brand that matters, I knew this was an opportunity I had to take. So I started digging in. I started doing some research. And I started reading these analyst reports over the last 15 or 20 years saying that consumerism is coming to healthcare. Let me tell you why it's not. First off, the category is incredibly hard to use. Siegel and Gale's Brand Simplicity Index ranks 25 industries every year. Consistently, health insurance is 25 out of 25. Dead last sounds pretty bad until you realize the cable companies are doing better than we are. The second thing that we have a problem with in this category is the language that we use. When I get a physical, I'm a patient, but is she my physician, my doctor, my PCP? If I go to physical therapy, I'm a client, but is that my therapist or my coach? If I call my insurance company, I'm probably a member or a membership number. And if I listen to the analysts, I'm a consumer. Let's think about this for a second. Has anybody in here been to Busch Stadium? All right, we got some Cardinals fans. That's great. So how many of you are consumers of baseball? Nobody. You're not consumers. You're fans. You're players. You're coaches. Some moms are chauffeurs to the practices, but we're not really consumers of baseball. Just like in automobiles, we're not consumers of cars. We drive and we ride. It just gets worse. When you first join a health insurance company, they might call you and say, hey, we want you to fill out this HRA, Health Risk Assessment. Really? My first interaction with you as a company is you telling me that my health is a risk to your business? Or the term health insurance itself? Is there any other insurance product that you plan on using on a yearly basis, or do you just hope not to use it? Do you show your auto ID card when you get your oil changed? The third thing that has to happen for consumerism to come to any category is, as consumers, we need to be able to assess the value equation. So what is value? It's a combination of product, price, and convenience. Convenience in healthcare is pretty easy to understand. Is the doctor's office close to where I work or where I live? But how many of you believe that a 10 a.m. appointment is going to start on time or finish by 10:45? Time is another important aspect of convenience. When we think about product, we think about quality and performance and other attributes. In cars, this is really easy to assess. How many cup holders and how fast it goes, the styling, the color. I can check it out on Kelley Blue Book or Auto Trader. But for healthcare, as consumers, we generally just assume that the state only licenses practitioners who are good enough. That's not a thorough investigation of product at all. And now I come to my favorite, price. It is not possible to talk about price in this category without discussing the EOB, the notorious Explanation of Benefits document. Does anybody here try to read that thing? There's two reasons why you don't. First, because it doesn't explain anything and it's not beneficial. The second reason is because it gives you permission to discard it by saying right across the top, this is not a bill. Is there anything else in your life that describes itself by what it's not? Your passport doesn't say this is not a driver's license. My son doesn't run around saying, I'm not your daughter. This is a legislatively required document that we have to send out that tells you how much you owe and to whom you owe it, but it doesn't help you pay anything. We already mentioned the cable companies. No matter how many pay-per-view movies you order or late-night boxing matches, how many bills do you get from your cable company? 1 a month, 12 a year. How many pieces of correspondence regarding cost do you get from the healthcare system? Nobody knows. Partly because we go and we deliver a copay at the time of service, and we get a bill later, but we don't pay the bill because we don't know if it's been adjudicated because the EOB hasn't showed up. And even if it has, I might not have looked at it because I already threw it out. So I wait for the second bill and the third. And if this sounds exhausting, it's because it is. Imagine this. You're hungry for lunch, so you go to the local burger joint and you order a cheeseburger meal. And you get to the counter and the cashier hands you a bag and says, "That'll be 25 cents. And you're like, "Really? This only costs a quarter?" And she says, "No, that's your copay. You're going to get a bill later, and maybe your food insurer will have adjudicated to let you know how much it really costs." If that were the case, would you buy anything there anymore? As you can see, the healthcare system is incredibly complicated, chaotic, and complex. Unlike toilet paper, it doesn't deliver a satisfying experience. So, what do I mean by experience? Thanks to the Super Bowl, we all think we're experts at advertising and marketing, right? To evaluate those ads. We spend a lot less time thinking about experience, although we feel it when a brand gets it right. I like to think about 3 levels of experience. The lowest level is transaction. There's no emotion involved. I give you money and I get a ticket. If it's a bad experience, if I buy a counterfeit ticket, I feel angry and frustrated. But there's really no positive emotion to a transaction. And engagement is the next level. Think about the difference between looking at box scores for the Cardinals or looking forward to a Sports Illustrated cover story on your favorite pitcher. This now brings us to relationship, kind of the holy grail of experience. I'm going to tell you a little story to illustrate this. In 2012, in the autumn, we had just moved to St. Louis. My wife and I were sitting in the living room, and all of a sudden, her cell phone went off, and my cell phone went off, and the landline went off. And we look, caller ID says superintendent of schools, and we immediately think that something has gone awry. So we listen to the message. "Hello, this is the superintendent of the school system. We just want to remind you that the playoffs are starting tomorrow, so make sure you wear your St. Louis Cardinals gear to school." That's a relationship with a brand. Not only do we buy hats and shirts, but we give them as gifts. We collect bobbleheads. We buy beers. We buy hot dogs. Because of a great relationship with that brand, we connect with family, we create memories, and we feel pride in our community. So, can we get to relationship status in healthcare, and why should we care? The why we should care is actually pretty important. The better relationship we have with the healthcare system and with our own health, the more likely we are to have better health outcomes. How we get there is a lot harder, although I'm going to make it sound really easy. There's only 3 things we need to do. First, we need to observe the category and tell the truth about it. Second, we need to imagine a better future. And third, we need to make it happen. Let me illustrate what I mean about observing the category. So I mentioned that I started on Charmin, which is poop coming out, and I ended my career at P&G on Iams and Eukanuba, which is poop going in. My kids like to tell me that I have the whole poop cycle covered, so at drinks afterwards we can talk about that. But I also learned some skills and some discipline in consumer packaged goods that we could bring to the healthcare industry. And one I'd like to talk about is called consumer journey mapping. This is where we understand what our average member looks like and how they interact with the healthcare system, not just with us and the potentially 750 pieces of correspondence that we could send out throughout the course of the year, but with the entire healthcare system. And on average, we as consumers interact with the healthcare system about 120 times throughout the course of the year. In over a third of those instances, we are actively alienating our consumers. That's not good. We need to fix that. Let me tell you what I mean about using our imagination. Simply, we have to ask, what if? What if pricing were as easy to understand as the menu at Shake Shack? What if researching procedures and doctors were as easy as searching on Zappos or AutoTrader? What if we could combine the EOB with the hospitals and the labs and the doctor's bills and provide additional information that's as engaging as our favorite magazine or as easy to pay for as a hot dog at the stadium? Now, we come to the hard part of making it happen, driving these changes. Instead of giving you an example, though, I'm going to leave you with a thought. The great American philosopher Ralph Waldo Emerson once observed, "The first wealth is health." If we believe this, then we have a responsibility to educate ourselves on the opportunities and act to solve them. As consumers, as people, we want to be treated with dignity and respect, and we need to demand that from our healthcare system. As healthcare professionals, we need to bring best practices from wherever we find them into this category. That means using pricing that's transparent, language that's simple, and delivering interactions that engage. If we do this, we have the opportunity to create a new paradigm, one that can destroy the negative trends that we're seeing in healthcare and instead deliver on the promise of simple, accessible, valuable healthcare that will result in longer, more meaningful lives. But we have to act now because our collective health depends on it. Thank you.